Okay, we are live, and this is the conference committee for H91. And we already met this morning, looked through some of the recommendations from the House, and now this afternoon, the Senate is providing some recommendations on the bills. So Katie, why don't you can show us where they are? They're still highlighted.
Yep. So in which Land Office of Legislative Counsel, your proposal should say Senate proposal draft up at the top. And then we have the same highlighting. So there's a change in the findings section, and that is on page 3 to reinsert.
That's fine. I think that was just a mistake.
Oh, good.
Yeah, that's I couldn't remember any conversation about removing it. I didn't me either, so it's all good. That's all good. Yeah.
Senator Bohosky identified it as critically important, and we agree.
Yes.
Okay. Subdivision 2, legislative intent, subsection C, and subdivision 1. And the legislative intent language describing the transition to VHART, moving emergency housing and HOP into VHART. The language was added using consistent, stable funding. So it would read as the intent of the General Assembly that VHART replaces the provision of emergency housing through the General Assistance Program and the HOP program beginning in fiscal year 27 using consistent and stable funding. Next, should I pause there?
I have to think about that.
Okay.
I don't disagree with the concept. I'll just, be honest that I think we're all trying to walk the line of wanting a bill that makes sense and a bill that the governor's not going to veto. And so I just need a moment to think about that.
Okay, so I think the intent here is to ensure that it is a program that will have regular funding. So I don't know which is one of the words.
So we might just propose something. Okay, I just need to think about that a little bit. Okay.
How long?
Let's get through all your changes.
All right.
And we'll see if I need to. Okay, I'll let you know how long after I see the other changes.
Section 3.
I know what you're trying to do, and I appreciate it. And okay.
Section 3 is the portion of VHART taking effect July 1, 2025. I don't think we have any changes. Oh, we did have a change. This is the regional advisory councils. I'm on page 7, subdivision 1. This is the regional advisory councils in the list, the shall and may list. So in subdivision 1, statewide homelessness organizations has been moved from the may list to the shall list.
We have a suggestion in that area as well. Can you be specific about what you mean there? Because you folks actually have it in the May list to begin with. We didn't have it in the May list. You did. And so are you just changing your mind or?
Yeah. We think they belong there.
Can you tell me what organizations that you're thinking of here?
The Alliance for Homelessness. Which one?
You would think that they're going to be at each advisory council meeting in all 5 regions.
They may have representatives who can do that, and they may not. They can be invited.
Okay, I think that that's probably okay. I just, honestly, we were trying to go with the concept that you had created about the regionals being at the region and then other people consulting with as needed.
Okay.
I'm not sure it's necessary at the.
Okay.
But let me just tell you the other thing that probably the same person that was talking with you about this was talking with us also. So under local housing coalitions. So in Chittenden County, the CoC is the local housing coalition, but they don't call themselves a local housing coalition. So, so there was a suggestion that we say local housing coalition or local continuum of care serving as the local housing coalition.
That might work.
That incorporates the differences between what happens in Chittenden County than what happens in the
Other
rest of the state.
places.
Yeah,
You're right. Sure, let's do that.
okay.
And then I'm turning to, Mark, Senator Kulik. Do you want to comment on the,
Statewide goals?
yeah,
No, I think there was a desire to be included and I'm certainly, I'm happy to include folks who are really, excited to do the work. That was where that came from.
I would like to, because so I appreciate what we're doing here, creating the regional thing, but I think that one of the things I like about having a statewide voice on the regional coalitions is being able to communicate what is happening at the state level, because I do think it impacts what's happening in the different regions. So to me, that statewide organization having that representation is sort of that cohesive of how do the regions work together.
I'm fine with it. I want to.
Are you okay with this?
Yeah, but when I say the statewide housing, some of the communication, all that can be tied up is having the, the field directors that are going to be involved at each region too, are also going to be able to keep that communication tight. And I want to leave off the question I was asked, how many state homeless organizations are there? Most of them are regional, I know,
Yeah.
and homelessness, and there was another one that was mentioned. After those two,
that's about it.
that's about it. No, I'm good with it as long as, obviously, with the AHS field directors involved.
The only thing I'm gonna say is that there are multiple organizations.
Yeah.
It's not just one organization. So if you're intending to have all the statewide organizations, be at the regional, I'm just putting that out there as a potential issue. I mean, for me, it's not a big deal because we're not going to be trying to organize these groups.
Understood. But your suggestion is to add the continuum of care.
Because it's a specific Chittenden County
Yeah.
thing in order to make
Yeah.
it consistent.
Okay, that's fine.
All there.
Yeah, totally agree.
Yeah. Did you get that, Katie? Did you understand what I
The
meant?
local
Okay.
continuum of care serving as a local housing
Yeah.
coalition. Okay.
So we're okay with the statewide thing, recognizing that. It's going to be subject to interpretation at the local level, just so you know that.
Of course, you will.
Okay. Just,
They're the leaders.
Okay. Keep moving. In paragraph D on page 8, reimbursement for expenses and per diem for the members of the regional council who are not participating in a professional capacity, being increased from 4 meetings annually to 8.
and we don't have any problem with that.
Oh, good.
Okay. Okay, page 14. Use of hotels and motels. The language about shelter beds, some of which may be population specific, it has said shall be. On page 15. Subdivision D1, this section had a longer phrase attached in, shall ensure relevant support services established pursuant to subdivision 2206B1. It had referenced specifically in conjunction with emergency shelters, and that language has been removed.
Okay.
Yeah.
Okay, section 8, page 31. So this change in subdivision 1 takes the 515 that the House Conference added out of this first number. So it goes back to the Senate number of 5.085. Also, in this first paragraph, it removes reference to blueprint or bridges to health. And instead, subdivision 3 is added specific to bridges for health. And this is added, the language matches what was in the Senate proposal. And then, in subdivision 5, this is the 30,000.
3 million.
Oh, thank you, 3 million.
That's right.
Oh my goodness.
He is not working for joint this.
I will not analyze any numbers for you. Okay, so 3 million, adding to the end of that phrase, with any unspent monies carried forward. So in total, it would be 3 million to DCF to enhance capacity for the creation and expansion of permanent affordable housing, emergency shelters, and permanent supportive housing capacity with any unspent monies carried forward.
So we may have a counter proposal to that.
Which one?
Through the 3 million.
Okay.
I'm waiting to hear back.
Oh. Okay.
It's sort of apropos to your thought this morning that there may be flexibility to remove that $3 million.
Okay.
So I'm just waiting for a little bit of work.
How long are we gonna wait?
Not very long. And then I do want to be upfront about what I've been doing about this 515,000. So just so you know, I've been in contact with folks who work at the Green Mountain Care Board. And the legislative liaison, our Representative Lamper, is continuing to work on this, although it will not be in time for our discussion. I actually would appreciate having just a quick private conversation with you for just a moment on this, if that's possible.
Do you want to walk outside?
Yeah, just if you could.
Why don't we go offline for just a minute? Take a break.